A new study finds that most people in low and middle-income countries lack even the cheapest painkillers to manage agonizing pain.
We found in this study 61 million people every year who are living and dying in pain and with serious health-related suffering that we know that palliative care and pain relief could solve.
Here, Professor Felicia Knoll visits a cancer ward in Mexico. Knoll's own surgery for breast cancer became the catalyst for her interest in global pain management.
I woke up from a mastectomy and I remember the horror of the pain of not being able to breathe, and yet I got access almost immediately to pain relief, which allowed me to push through it much more easily. When I thought about other women going through this, when I thought about children, burn victims, and having their wounds dressed and cleaned and the agony of that without pain relief. And then when I found out how inexpensive it is to solve this problem, a real win-win in global health, that was when we really decided to move forward.
She chaired an international study on pain relief published in The Lancet. The results shocked even the researchers.
We looked across the world using, as a tracer, access to morphine, and more than 100 countries could satisfy less than 30% of need for pain relief just for palliative care alone. And in fact, the vast majority have almost nothing.
In the U.S., morphine costs 3 cents per dose. In low-income countries, it costs 5 times as much if it's available. If costs were the same for all countries, the study says it would cost $145 million to close the gap on pain relief. Even developing countries can work to close the pain gap. Uganda is one example. The government makes and distributes morphine for the country's hospitals. Doctors are trained in administering the drug, and patients are monitored. Knoll has enlisted the help of the World Bank to end the pain gap. Plans have yet to be formulated, but the goal is to provide pain relief for the millions of people who truly need it. Carol Pearson, VOA News, Washington.